Hey guys, today I want to do an unboxing, if you will, on the semaglutide medical weight loss program package that you receive when you commit to our program at your doorstep. So let's see what's inside. You will get the medication itself, syringes to inject, as well as alcohol pads to clean your vial and clean your injection site. And then you'll also notice a little informational postcard in here. First thing is the postcard that comes with it, so make sure you read everything. One little bullet that I want to talk about, it reads, this formulation is stable up to 56 days at up to 86 degrees Fahrenheit. So I know a lot of people would ask us, hey, I was traveling and I got back and my package, my semaglutide was outside for a couple days. What should I do? So that is what this is for. That is okay if it's outside for a couple days at 86 degrees Fahrenheit. It's a little hotter than that now as we're in the peak of summer, but just so you know, it's okay. Next thing, obviously your insulin syringe gauge needles and your alcohol prep pads. And then I do want to go over the actual medication box itself. So you'll first notice that there is a little label, prescription label on the box. Make sure you read that. There's good dosage information on there because it can get a little tricky with the units and the needle being so small. So make sure you look at this to make sure you're getting the right dose. Once you open the box with your semaglutide inside of it, you will see your semaglutide. A couple things that I want to point out is that, I don't know if you can see from here, let's see, it reads 5 milligrams per milliliter in the sterile solution of 4 milliliters. Okay, so that means that there are 20 milligrams total in your vial, which is the correct amount. A lot of people will say, oh, my vial is not all the way full. It is not supposed to be. If you can tell, it's only full to about here. That's normal. That's how it's supposed to be. That's plenty of product for 12 to 16 weeks that you will be injecting. All right, guys, now that you know what's inside your semaglutide package, let's get to how to draw up your medication and inject. So you have your vial, one alcohol prep pad, and your needles. So there's a little tearaway to open them right here at the top. Just need one. Go ahead, make sure your hands are clean before prepping your vial and drawing up the semaglutide. Okay, little blue cap on here, pop it right off. And you can throw that away, it doesn't recap, that's okay. Use your alcohol prep pad to scrub the top for about 15 seconds. And go ahead and dispose of that. You can take the plunger cap off, you also won't need that anymore. You can take the needle cap off, but save this, you will want to recap it until you're ready to actually inject. So go ahead, turn it straight up at a 90-degree angle, plunge in as one, turn it all the way upside down, and then pull on the plunger until you are at 5 units. And it seems like a very small amount. That's because it is. That's all you need. Again, remember the vial isn't all the way full. It's because you're using small amounts, small dosage. So go ahead and fill your needle to the 5 with the needle still inside the vial. Once you get it right at the 5, go ahead and just pull it straight out. Don't worry, it won't drip or anything like that. And go ahead and safely recap your needle. I will show you guys up close exactly what it looks like to be at the 5, because again, it is, if you're questioning, is this enough, then you're probably correct. All right, when you're ready to inject, I lied, you do need 2 alcohol swabs, so grab another from your package. Go ahead and clean off injection site. What you're gonna do is pinch the lower fatty tissue in your abdomen so that there's space in between where you can inject. And then clean like I just did, but clean, scrub for a few seconds. Grab your syringe that's uncapped if you're doing this by yourself. Just for video purposes, I'm not gonna actually inject myself, but I am just gonna show you guys the motion. So once you have that area pinched and it's dry after being clean, you're gonna take your uncapped syringe and you're just going to dart it in here and push the plunge down so that the medication goes into that fatty tissue and is absorbed. Okay, easy. Congratulations, you just injected your first dose of semaglutide. Once you are done injecting, you're probably wondering, what do I do with this sharp thing? And that is a good question. We do include instructions in your email and your welcome package when you commit to our program. That does include state regulations, appropriate way to dispose of the needles, and different drop-off locations. So there are a few options depending on what you prefer, but definitely read those instructions because that information is included there. All right, guys, one final reminder that is arguably the most important to you having success in our medical weight loss program using semaglutide is weekly check-ins. This is a luxury when it comes to these kind of programs because it allows our provider to personally dose your regimen for weight loss. So you are injecting semaglutide once weekly. On your injection day, we do want you to text our business line with a few pieces of information so we can help you maximize your results. That information is going to be your first and last name, the number of units of semaglutide that you're currently taking, your hunger level on a scale of 0 to 10, 10 being starving, 0 being not hungry at all, and finally, any side effects you're having, if any. Like I said, this way our provider can personally dose your regimen for semaglutide and maximize the weight loss that you see. We also just want to remind you guys that we are here for you with any questions that you might have, any questions, comments, concerns, feedback. We're happy to hear it all and happy to help you troubleshoot anything that you might be having issues with. Know if there's anything that you guys need from us, and we will be happy to help out.